Hi, I'm going to demonstrate a tear trough injection. Just a quick little bit about tear troughs. Not everybody's a candidate. People talk about bags under the eyes, people talk about dark circles, but it just depends on your anatomy. On this beautiful patient, what we have is, if you look up at the ceiling, we have fat pads, 1, 2, 3 lower lid fat pads, and then there's a tear trough under it, then there's a cheek. So by injecting this little zone, you can blend the two together. Traditionally, you would do a transconjunctival or a blepharoplasty just to remove the fat pad and bring it down. But with filler injections, you can kind of smooth that area without surgery. But again, we have to assess you, see if you are a candidate. I'm using Juvederm Volbella. It's the softest filler. Restylane is also another go-to for me. I also use velour in this area, but this depends on the anatomy. So rest your head back and look up at the ceiling for me. I'm gonna take a little bit of filler.
Deep breath.
The injection is going to be in multiple planes. I'm injecting as I'm going through. You doing okay?
Yeah, fine.
The closer I get to the nose, the more sensitive it is. But you can kind of see from below. I'm cognizant of where my needle tip is. I'm not filling on my entry point. I'm filling where it needs to be filled. Good. Look up for me again. Look straight. Perfect. So if you sit up and look straight, straight gaze, not looking up at all, head just up a little bit, up, and then looking straight down that way. You can see as you look up, it gets worse because this that fat pad has to remove surgically. But as you look straight on, what you see is here, she has that trough, and here it's much smoother. And if you look down, then you can see it's completely gone. So again, we're injecting it based on the front gaze, not based on the up gaze. So go put your head back for me. Let's do the other side. No bleeding, no bruising. Okay, ready? Keep your eyes up at the ceiling. I'm going to go to multiple different planes. So the question always comes up about cannula in this area. And cannula is fine, except you can't go to multiple planes because of its blunt nature. It finds its way in a layer where there's not a lot of connective tissue. You can't really go into the layers that a nice sharp needle can go to. Holding a little bit of pressure, just to make sure we don't get any bruises. She's barely bleeding. But if you see a tiny bleeder, just hold a little pressure and then go back to it. Is that painful?
No, not at all.
Okay, good. Okay, so we keep checking. Maybe sit up again a little bit for me. Look straight at me. Look at this level right there. Good. Now go back again. Close your eyes. You can close your eyes now if you want. So this is a little deeper injection. Not too bad. Open your eyes. Much better. You see that immediately. Close your eyes. I'm going to have my assistant hold pressure on this side. Good. Yep. Close your eyes again. Okay?
Mm-hmm.
This just makes you look more rested. Makes you look like you slept more. Even if your life is hectic and you can't sleep, this just makes you look like you did. Fake it till you make it. This is what it does. And it's immediate. It's not surgery. Don't have to wait for results. It's immediate. Let me have you sit up again one more time. Look straight again. I already see. Look a little bit this level. Bags are gone. Put your head back again. No fine tuning. Keep your eyes closed. See again, I'm going for multiple different layers just to build volume. An area that lacked volume. Open your eyes. Take a
Oh,
look.
it looks really good.
Yeah.
Looks really good.
That didn't hurt at all.
Almost done. Close your eyes again. Open your eyes. Look up for me. Can't even see back this side. Perfect. Got a little bit more on this side. We're done. Look up again. Up. Good. Done. No big bruises. Very smooth. Don't feel any lumps or bumps. Okay. And that's it. So let's take a picture. We'll compare the before after for you immediately.